Okay, so once you understand your state practice act, now you have to start thinking about your documentation. How are you going to document? Are you going to use paper charts still? Are you going to use your Google Drive? Is your EMR system going to have templates already there for you? So you have to start thinking about how you're going to start documenting this, because especially if you're doing skilled PT services, whether you're seeing auto cases, workman's comp cases, lawyer cases, and even what your state practice act dictates, you have to document some of the stuff at least. We're not just going to be personal trainers doing personal training here. That if you're doing skilled physical therapy services, you have to have your documentation done. So you have to decide, depending on what EMR system you have, are you going to create your own templates within the EMR system? Are you going to be able to upload Word documents and store them on your cloud or your Google Drive, or still use paper to like start off with? So you have to make that decision. When I started, I was using my G Suite or my Google Workspace. I created all of my documentation in Word or Works documents, and I uploaded them to the Google Drive in certain files. So I had everything stored on the cloud, and I could just copy paste patient name, write out my eval. So here's a list of the forms that you're going to need to have. So, we pretty much put past medical history plus consent to treat plus the testimonial waiver and the notice of privacy practices into one form or one document, which I call the new patient paperwork. Okay, so it's a fillable PDF that patients can go through and fill out on a computer at home, or even via email still, that they can fill that out, and they can even download it from the website. But you have to have all your new patient paperwork taken care of: past medical history, consent to treat, and notice of privacy practices. We have a communication waiver, so the patient understands. Patients want to text and they want to email, but you have to go through, HIPAA compliance. And if an email is on an encrypted network and you're emailing to an open network, that's not secure. That's a open network. It has to be encrypted to encrypted most of the time to be fully secure. But patients want to text and they want to email still. So we have a communication waiver that they all sign, and they want to be able to have access to that. To be able to share a patient picture or to post on social, you have to have a waiver form also. So we have a testimonial waiver form too. An ABN, again, remember, you're only using an ABN if you are a participating provider with Medicare or have any relationship. We have no relationship with Medicare, so we don't use an ABN at my clinic. But if you do have a relationship with Medicare, you have to use an ABN. We created our own Medicare form that we get our Medicare beneficiaries who come here and pay cash, that they have to sign that. We do not use an ABN. That means you have a relationship with Medicare. You have to do the No Surprise Act waiver form too. That was a law that was, I believe, passed in 2021, I think. Man, time's flying. I thought that it sounds like it just started, but it's actually been a couple of years now. But we have to do a No Surprise Act waiver form. I created my own dry needling consent forms, the eval document template, SOAP note templates, progress note templates, discharge note templates, and a reimbursement form. We do give out reimbursement forms to all of our patients. So we have a templated version, which is, pretty much a version of a CMS 1500 form, pretty much, but it's in a much user-friendly outline. Those forms, I can't believe people still use those forms, but that's what insurance companies want. They want to see it on that form still, which is mind blowing. There has to be a better way. But, the next step is you got to start creating all of your documentation for this. This is a list of all the documentation that we currently use. If you don't have access to your own, or you don't feel like designing your own, you can click on the Business Essentials course, where you get all of my templates to use here. And you don't have to worry about it or pay a lawyer to create it. I have it already done for you. So you can just click on the link to the Business Essentials course and kind of look at all this stuff and get access to all that stuff. So the next step is going to be creating your documentation to start seeing patients.